Before we begin the head-to-toe assessment on my patient, I've reviewed the chart and looked at the age, gender, and ethnicity to determine the type and size as sphygmomanometer as well as thermometer. I've also looked at my patient's medical history to determine if he or she can sit or stand. Before we begin, I'm going to list off the vital signs. Blood pressure 118/70, pulse 68 beats per minute, O2 saturation 97%, temperature 98.2 degrees Fahrenheit, respiration 15, pain 0, weight 163, and no tubes, dressing, or equipment is on my patient. Knock, knock, knock. Hi, my name's Taylor. I'll be your nurse today. Can you verify your name and date of birth for me?
Elena Elkins, 4/10/2001.
All right, any allergies?
No.
Can you tell me where you're at?
The hospital
Can you tell me why you're here?
for a physical assessment.
Can you tell me who the president is?
Donald Trump,
Can you tell me the day?
Friday.
All right. So you don't have any breaks in the skin, so I'm not going to put on gloves. So to begin, I'm going to start with your head and neck. All right, I'm going to look at your pupil and pupillary response first. So I'm going to have you look forward for me. All right, perfect. Either eye. All right, good. I'm going to have you look at my finger and follow it to your nose. All right, good response. Now I'm going to look at your face symmetry. So everything looks good. Can you smile for me? Can you clench your teeth? Can you stick your tongue out? Can you move it side to side? Can you raise your eyebrows? Can you lower your eyebrows? Can you close your eyes? All right, I'm gonna assess your sclera and conjunctiva for color and moisture. Everything looks good. Now I'm going to move on to your mouth. So everything looks good outside. No decaying teeth, no sorties, no lesions. You see your gums. No gum recession, no bleeding. All right. I'm going to move on to your neck for vein extension. All right, everything looks good. All right, we're going to move on to your chest. So, first thing I'm going to look for is shape and symmetry and the use of respiratory muscles. So everything looks good, you're breathing fine. Do you have any breathing problems?
No.
Any coughing, any sputum production?
No.
All right. So before I begin listening to your heart sounds, I'm going to identify where each spot is. So aortic, pulmonic, tricuspid, and mitral. I'm just going to have you breathe normally for me while I listen. All right, everything sounds good. No murmurs. Strength was 2+, so everything looked good. So I'm going to move on to your breath sounds. before I have you sit on the side of the bed, I'm gonna look at your skin turner. All right, perfect. Now I'm gonna do your back. All right, everything sounds clear. No fluid or anything, so that's good. I'm gonna have you lay back down for me. All right, we're gonna move on to your abdomen. Can you tell me your last void and bowel movement?
Probably last night.
All right, do you have any pain, nausea, discomfort?
No.
All right, I'm gonna listen to your bowel movements. All right, good movements. Now I'm gonna assess your abdomen for shape and size. Everything looks good. I'm going to palpate for any masses. All right, everything looks good. We're gonna move on to your extremities. So to start out, I'm gonna start with your hands. So I'm gonna feel for temperature. All right, I'm gonna look for color. Everything looks good. Make sure your pulses are the same. And no edema. All right, I'm gonna look for capillary refill. All right, 2 seconds, perfect. Now I'm gonna have you grip onto my fingers and, yep. All right, good bilateral strength. So now we're gonna do range of motion exercises. So I'm gonna have you lift your arms up, like this, back down. All right, perfect. Now we're gonna move on to your lower extremities. I'm gonna also assess your lower extremities for color. Everything looks good. I'm gonna do temperature and no edema. I'm gonna make sure your pedal pulses are symmetrical. All right, now I'm gonna do your capillary refill. All right, 2 seconds. Now I'm gonna have you push against my feet for me. All right, perfect. Now the other way. All right, great. Now we're gonna do range of motion exercises. So I'm gonna have you lift your leg up, put your knee to your chest, perfect. I'm gonna have you go out, perfect. Now I'm gonna have you go in. All right, I'm gonna do it on the other leg. So knee to your chest, perfect. Now out, now cross over, and I'm gonna have you put your toes, yep, and then toes outwards. All right, well everything looks really good. You have good heart sounds, good breath sounds. Your color looks good. Do you have any questions for me?
No.
All right. Well, I'm gonna go document. If you have any questions for me, you can just let me know, okay?
Okay.
All right, thank you.